What's your thoughts on narcissism?
It may be a personality of the person that the world is revolving around them and they can control people, control things. But I will be very careful to label people with that. To some extent, when normal people do have that kind of thought process. But when somebody is trying to control others, then it can be a problematic behavior. Today, we are facing a mental health crisis basically, where 1 in 4 people grappling with some form of mental health issue. Currently, over 1 billion people globally suffer from mental health issues.
What do you think needs to happen in the mental health field that will make a shift to where everyone is more aware and able to distinguish what is a mental health problem versus something else? What do you think needs to happen in the overall industry of that?
I would say first.
Our guest today is Dr. Thomas Idiculla. He's a director of mental health services at McLean Hospital. He's an instructor of psychiatry at Harvard Medical College. He's a researcher in various different topics. Some of these topics include mental health, chronic mental illness, disparities in gender, ethnicity, and race in regards to health. And we cover a lot of these topics. I hope you enjoy this conversation. Let's get into it.
Before we continue, I want to plug the GoFundMe below. We're raising money to build water wells in India and other places of the world. This is for small villages, rural areas that don't get adequate drinking water or clean drinking water. They don't have a neighborhood dollar store or Walmart that they can just pop by and grab some bottled water. So we've been doing this and it's been successful the last couple times we've done it. And it doesn't take a lot of money. $500 is pretty much all we need, and we can build at least one or feed a couple families with that money. So can you help us reach our goal of building 3 water wells this year? That means $1,500 total. And so with your generosity today, someone or a group of people today can say they are alive and well. Thanks.
Thank you, Dr. Idiculla, for being with me today.
I appreciate the opportunity to be with you today, Chris. I'm excited to share my journey, especially into the mental health profession.
Before we get started into the questions or the things I like to discuss, I always like to understand a person's younger days, meaning their childhood days, because I think a lot of how we think today or our ideologies and our environment is sometimes shaped by how we grew up. So part of my question is tell me and tell our audience about young Thomas. What was young Thomas like? What was your family like and your parents, your relationship with it? How was it all when you were growing up?
Well, I grew up in a traditional Christian family in India. Kerala is a beautiful place, and the most important thing I can remember is my parents' affection. And I would say my parents played a significant role in my life, instilling the values, essential values, biblical stories, and teaching principles of Jesus, especially from the Sermon on the Mount.
When you were around your parents, were they very strict in certain things growing up for you? Did that cause you were you more sheltered as a young person, or were you able to explore and see a lot of things when you were younger?
I was not an easygoing child. Therefore, even the parents were strict. I found always a way out. At the same time, I kept the Christian values no matter what. Especially, there was strict curfew that by evening 7 p.m. you should be back to home. There's no excuse. But how you spend between 5 and 7, you have a lot of flexibility, especially for sports, games. I enjoyed that time.
Were you very active when you were young? Did you play a lot of sports or things like that?
Badminton and soccer, that was the only thing available on those days. Even after the school streets transformed into playing grounds. And that's a great opportunity to experience the true friendship with your colleagues and friends those days.
So all these years growing up, what drew you to your specialty, to the mental health side of your practice or the research? Like, what was the turning point in your life that made you think, I want to do a little bit more work in the mental health side?
My journey into mental health and psychiatry began with a deep curiosity about human suffering and desire to understand and support families especially with chronic severe mental illness. Even in our neighborhood, I have seen people, I never understood why people acting out in such a way, especially the chronic schizophrenic patients. I became particularly interested in the complex interplay of biological, psychological, and spiritual influence of mental health issues, especially in India. People have defined, and especially the cause of mental health issues is all over the place. Even the educated people, the intellectuals believe that this is something not medical. I think it is during my graduate studies that I gained tremendous experience through the child guidance clinic as well as psychiatric hospitals to have first-hand experience to see who they are. They are human beings, they need respect, they have a mind, and definitely there is a way that these people can be helped, family can be supported. That motivated me quite a lot to do further research in this field.
Was there a specific case or patient or some story that sticks out in your mind that you thought there's something more to this this that you're not seeing, this mental health stuff that you're not seeing?
I think it is the families who are caring for these people that was the turning point in my life, because most of these parents have no clue about this illness. Psychoeducation is a great tool. I would say families, unique families who are helpless, stigmatized, and not getting enough help. That basically was the turning point to pay more attention to this field.
You said the word psychoeducation. What does that mean to a general audience that might not understand what that is? What do you mean by that?
There are different ways of explaining. This is a systematic way of teaching about what is mental illness, the cause of mental illness, to reduce the stigma attached to mental illness, what kind of coping strategies is helpful, or even how they can get the right resources to help their family member who is going through chronic mental health issues.
When you talk about chronic mental health issues, how do you get to a chronic mental illness?
Most people don't seek help. They go to the wrong place for help. And because of the stigma, and that is another reason they don't seek help. They contain the patient, lock the patients, and by the time that they know that this is getting worse and worse, and that may be the reason they become very chronic. It's not just the pain alone. The cognitive function of the brain itself can be challenging as you keep it for a long period of time, because they are isolated. They are not involved in any day-to-day activities. That alone can bring a lot of further disability, especially to the mind. That can be the reason for the long term. You can see the chronic aspects of it. It can be, mind can be severely impaired by that time.
Can you describe, or can you tell us, like, what are some things, some signs or symptoms that maybe we can look for that would help us distinguish what is the difference between that young person who has the mental health that might be developing something wrong, or they're just a normal child that is just has a weird personality or grumpy or stuff like that, right?
That's a good question, but a tough one. Normal transition itself is challenging. It's very difficult for parents to differentiate between what is a normal challenge versus an abnormal challenge. Certain symptoms at the age of 12, 13, 14, ADHD diagnosis can be some early signs, especially when it comes to psychosis. It can be very silent, not socializing with friends. I'm not saying that introvert personality, but extreme introvert behavior, avoiding people, situations, or certain people can explode without much reasoning. They may look through a magnified lens because of how they see reality. But if they don't have the support and help and timely medical help or psychological help, it can get worse. The development of the brain, which is very clear by the age of 25 and all, that's where you can see very clear cut symptoms of psychosis or even bipolar disorders or sometimes addiction. All these things become very clear, and there are differential diagnoses now to see what this be. There are more than 800 diagnoses now in according to APA, this computerized diagnosis, and we also have developed a world-class tool called Basis 24 through McLean Hospital and Harvard Medical School, and that has given some clarity to assess more precisely. 90% of the time it corroborates with what a psychologist think. Thus, it's a very sensitive and specific diagnostic tool in psychiatry now. It's called Behavior and Symptom Identification Scale. It's been used by US Army now. There's more than 200 hospitals in the United States and in 5 other countries currently using it. Those screening tools are very useful to early identification of the mental health issues.
Just to give a little recap, so some things that you can probably look at is if they're not socializing to an extreme, or they're extreme introvert, or maybe anger exploding. These are some simple things that maybe we can start thinking that, hey, something's not right, and maybe we seek some outside opinion on uh on the child or on the person or whatever. Those are some simple things we can probably look at. Is that safe to say?
Definitely. I will give another example also. For example, there is exam stress. Students will be super panicked. That's all right. Or there is some loss or death in the family. That grief is a normal thing. Or there's a thief in the neighborhood. It's okay to get anxious.
Right.
But when there's no reason around you, when somebody is panicked, consistently anxious for weeks and months, or not sleeping properly, that's a clear sign. Someone cannot sleep, or not taking the food, always lying in the bed. All these are related symptoms. It's not just look at one or two there. I would look at the cluster of symptoms. These all things can happen even to normal people, but you have to look in perspective. What's a family? Is there any abuse going on? Is there any loss? Even then people going through all these challenging symptoms, that may be a confirmation that this person needs help.
What's your thoughts on narcissism?
It may be a personality of the person that the world is revolving around them, and they can control people, control things. But I will be very careful to use and label people with that. To some extent, when normal people do have that kind of thought process, but when somebody is trying to control others, then it can be a problematic behavior. Especially in the workplace or in the husband-wife relationship or parent-child relationship, you can see a clear narcissistic will have extreme dictator type behavior, which is tormenting, which is painful. You can't even communicate or talk to a person in a democratic way. And it's a very authoritarian way of controlling, a tiger type behavior.
Yeah.
I'll be very careful to label people until, that's it. People use when you don't like somebody, he's narcissistic or she's narcissistic. I see that with the couples also these days use that kind of labeling very often. Not always necessary to use that kind of language because that can disconnect people.
Do you see that there are actually more people today who are narcissistic, or do you think that they're just labeling more people as narcissistic and maybe they're not? More people are saying because we grew up in that era of technology, social media, and things like that, that there's more humans in our millennial age range and Gen Z age range that are more narcissistic than maybe the boomers and, before that, or what do you think?
There are different way of labeling people. Some people say it's extreme stress now. More people are neurotic or more people are narcissistic. But the reality is mental health has become a hot topic, making a positive shift towards greater awareness and understanding. Today we are facing a mental health crisis basically, where 1 in 4 people grappling with some form of mental health issue. Currently, over 1 billion people globally suffer from mental health issues. And there is 3 interrelated crises going on. For example, the rising rates of anxiety and depression, especially among the youth. But among the adults, you can see some severe mental illness like schizophrenia, bipolar disorder, which contribute to social issues, including homelessness, incarceration. Then there is an ongoing substance use crisis. It can be two-sourced. Prescription medication itself is becoming more complicated, especially the opioid crisis. It's very sad. A lot of people affected, and dangerous drugs like fentanyl poses additional risk. While these crises have distinct causes, we already possess a viable solution for all these 3 also, but most people are not aware about it. This kind of education definitely will empower people to seek help, timely help.
You said 1 billion people probably struggle, or 1 in 4 people. Do you think that it's more common in a certain region of the world, like if it's in a more of American? Because I read something the other day that more of the Western world struggles with mental health than the Eastern world. I don't know how true or not true that is, but do you think that there's a certain region of people that struggle more, or have your studies shown that?
I would say definitely there is more depression and anxiety in the developed countries. There is no question about it. But mental illness, irrespective of time and region, it is there. The question is what kind of early diagnosis available? Who diagnoses these people? Where, for example, in India, 80% of the people cannot afford a psychiatrist or a psychologist when they have a problem. There will be underdiagnosed population in developing countries compared to United States and other developed countries. At least people may seek help when there is a problem. There is documentation, there is medical records, and statistics would be available. The only difference I can see is in the developed countries, definitely because of the easy access to drugs as well as the media. The anxiety, depression, those dual diagnosis is way high, which some of them are preventable problems. And here it's somehow they are managing. Even with people can be functional with problems, but in other countries, people may not have those kind of help that is available when somebody diagnosed with this. I think it's very questionable which region has more and cause and effect there. We need more research, valid research to make any conclusion.
It's on the same topic, but I want to get a little more specific. So you are Indian and born and raised, and you're in a Malayali culture. What is it about the culture of Malayali, Keralite, Indian people that it seems like mental health is not talked about? I don't know how true or not true this is, okay? Sometimes people tell me we have too much pride to think that there's mental health problems in our culture. What do you think about this?
There is a reason for that. It's not only in the Malayan Indian settings in general. When anyone identified or diagnosed with mental illness, they consider it as a curse. It's a curse from God. The second thing is there is stigma attached to it. For example, if a person is identified with mental illness, then people may disconnect even their own relatives, their friends, because it's a curse.
Right.
There's people don't hang around with them. There is a reason why people, not pride alone, it may be something they can't share with other people because they are humiliated. But things are changing, especially in the United States, even the Malayalis, Indians. Most people are seeking help, but at the same time, there is a resistance to medication. They like counseling, psychotherapy, but there are a lot of misinformation about psychiatric medication. That is true. In the olden days, psychiatric medication had a lot of side effects. But modern medicines are, I would say, for a period of months or, for years to take, that may not affect much. It's better to take the medication rather than getting into a severe chronic stage. With medication, that definitely liberates a lot of people. And my take on this is to deal this stigma attached to mental illness is more awareness, more mental health seminars, support system within the church community. When you integrate with a primary physician, you are a physical therapist, just talk to people, not only about their physical condition, how is your family, how is life. That maybe this is our role interface to connect with people to talk about their life. It needs not necessarily to be handled by psychologists and social workers. This needs to be part of the general healthcare.
I totally agree, and that's part of the reason I want to have more of this conversation is because when I was in school, they had like maybe 2 3 classes of just talking about mental health. Out of 4 years I was in school, 2 3 classes, and it and there were some professors that spoke a little more about it, and some that that was their thing, right? But as I've started practicing and seeing patients, and I'm with a person for an hour, maybe at times, right? And an hour of talking with them, that's a long time. You get to know their life, you get to know their anxieties, you get to know all the details, you get to know it. And so I've noticed that it's a skill, and an assessment that every therapist, physical therapist at least, needs to have in their tool belt. How to, one, just conversate. Two, how to appropriately assess whether and give good questions, right? To maybe see if there's some signs or symptoms that are, oh, they're drifting towards this. And we can't diagnose, but we can say, hey, maybe you should talk to a mental health expert or a psychiatrist, or right, because that's
Absolutely.
how it should get pushed, right? But if we don't ever practice and develop those skills, then it becomes a missing piece. And so that's something I've seen, and you're totally right. I agree. Every healthcare professional, I think, needs to take that a little more serious, especially since that's a pretty alarming statistic that almost 1 in 4 people have deal with some kind of problem.
That's true.
So in physical health, you can Google some exercises, and say, hey, how can I run better? How can I lift heavier weight? And they'll give you a bunch of exercises, right? Mental health is kind of being talked about more these days, but still it's not highly like sought after. Like, if somebody sees a problem, they'll say, go talk to a psychiatrist or whatever. It's talked about more, but not like physical health is. There's so much research and data on physical health. What do you think needs to happen in the mental health field that will make a shift to where everyone is more aware and uh, you know, is more aware and able to distinguish what is a mental health problem versus something else? What do you think needs to happen in the overall industry of that?
I would say first incorporating mental health education in the school curricula. It can foster understanding about cause, prevention, even intervention, reducing stigma, and encourage open discussion about this stigmatized issue. Secondly, increased access to mental health screening, which is missing even in the schools, and providing timely resources, timely treatment. A lot of people, even for physical pain, they know what to do. But when it comes to mental health, the brain may not decode things correctly because the person themselves don't know what's going on. Thus, even the family members can misdiagnose that also. Additionally, training professionals such as educators, school teachers, religious leaders, healthcare providers, multidisciplinary team approach, where because these are all, sometimes people may go for physical therapy for back pain. Well, the underlying problem may be something else. These are all great opportunity to connect with people, and if there is, definitely there can be physical problems, but they may need mental health help also. In addition to that, community support programs such as church groups can help individuals feel connected and supported in their struggles. Thus, by taking these steps together, we can break down the barriers, enhance the understanding, and cultivate a society that values mental health as much as physical
Yeah,
health,
that's really good.
which is a journey. That should be the goal, I would say.
I want to switch gears a little bit to soul health, because I think maybe I'm assuming, But when you're a religious person or maybe a Christian, and you think about mental health, you think that, I think you said this earlier, it's like, oh, they just have a demon in them, or they have some kind of like problem with God or whatever, or maybe God's cursing it. How do you address people that have maybe a spiritual or soul issue versus like a mental health issue? Or do those things go hand in hand? How do you think about that?
I put a disclaimer as I speak on this. In psychology, we don't deal with spirit. We deal with the mind and the body, as you know. That is, health science is built on that. But the holistic approach always give, in addition to the mental health and the physical health, there is something called spiritual health. Even the WHO's definition of health is, you can see in 1940s when they defined health is defined not merely absence of diseases or any kind of disability, it is the total well-being of the person, including physical, mental, social, and spiritual aspects of that person. That definitely there is a spiritual side to it. Faith, spirituality contributes to the person's well-being. There is enough research on that. I consider religion, if it's used in the right perspective, it can be an asset. It is an investment. It can be very supportive, but it can be misused also. That's why you need to have accountability, especially when you deal with mental health issues. It's not like preaching and teaching. We are helping a person. For example, somebody is suicidal. I would say, along with their religious prayers and help and support, I would refer that person to a professional to get timely help. Like a heart patient, you pray for that person, you help that person, but at the same time you refer to a cardiologist. That there are certain common sense approach when it comes to even for religious people, which there is a lot of educational materials available, how this faith and science can go together. Instead of being conflicting, it can be more integrative approach for mental health as well as the holistic health of the person. There's even more recently, we had even the place I work, McLean, we asked our patients at the time of admission whether you want a more secular kind of help or an integrative approach, which is more faith-based therapy. 60% of the patients preferred a faith-based integrated therapy along with that,
Wow.
which is definitely there is a whole department now to have spiritual counseling available that's based on their background. I think we have to open up because this is an area where it's not like you are giving a tablet to person and say, all right, they need to have a holistic approach. The family need help, the person need help, it needs physical, mental, social, and all kinds of help needed. You're dealing with a problem we don't fully understand. We may know 60-70% of the causes. But certain mental health issue diagnoses are very clear, black and white, but some of them very complex and complicated.
Do you think that there are some mental health diagnoses that are more of a spiritual kind of problem? I'm not saying this is true or not true, but whenever I hear people talk about multiple personality disorder, I always think like, well, that can be mental health too, but I think there's more like something deeper involved, some soul, spiritual. That's just my opinion. That's not true or false. No medical advice on that, but I'm just saying.
There is a whole research in this area, how you can distinguish precisely what is considered as demonic versus what is considered as a biological disorders or a psychological disorders. That's an emerging area. It needs a lot of sensitivity and check and balance. I don't think all religious leaders can, because traditionally religious leaders think that any form of mental health issues is demonic. The generation of research that is going, it was originally thought of physical side, certain group of people, when psychiatry emerged. Then psychologists believe it's all about the mind. Then a group of counselors and all believed it. So no, it's all about a holistic thing. It cannot be just one thing. There is a whole discrepancy as well as unique ways of looking at biological basis of schizophrenia. I think It's okay to be a scientist who believed in the brain and the cognitive aspects, all these things. But now you're talking about artificial intelligence. We can look at all this data. And in the past, we didn't have the ability to put all this information together. Now, I think we have the ability to see things in a dashboard, what is happening to a person, looking at the past, present, and looking at millions of patient records from the past. When the brain scanning data, we have the ability to see in most cases what's going on. But still, compared to other physical health, mental health is not yet there.
You talking about AI. I wanted to ask this question actually. Have you seen technology improve the mental health or just healthcare in general in your field? And what are some of the specific maybe AI, maybe the apps or the technology that you have come across that has been very interesting to you in this space?
We do have the person's healthcare information available, the lab information, a lot of things. If they want to do a good job, we can connect all these pieces. There's whatever needed to be connected from the patient, you collect, then the family, then from the physicians and other group. The AI definitely can bring it all together in a dashboard and make timely intervention and avoid costly treatment, but at the same time, the patient can benefit more the appropriate treatment. That can bring definitely a lot of positive changes in the person's well-being.
These next couple of questions are like kind of like rapid fire questions. So we talked about technology and you had answered that question. I want to ask about family stress. Can you give us examples of what family stress is and what are some strategies we can use to cope with family stress?
The big stress that I see that is common to any group of ethnic group is it's a busy life. The busyness of life is one. Second thing is most people are not organized in life. When we have smartphone, I do not know how many of them use the scheduling and all those things in the phone. That is a mini computer. You can manage your time very effectively or through apps. This or even your relationships with the intimate. Most people have healthy relationship with professionals in the workplace, colleagues, friends. What happens is the intimate relationship is that where you get more stress. The family is very intimate because there is no filter. When you talk to your friend or even your colleague, you have a filter, right? You have some framework, what is acceptable, what is not acceptable. When it comes to anger, stress, or misunderstanding, that's where it can complicate in intimate relationship, especially between husband and wife, parents and children. These are intimate relationship. If things are not clarified, cleared within a day or two or weeks, what happens is it will lead into major stress, avoidance, lack of communication, unforgiveness, bitterness. That's becoming very common. The first and the foremost thing I would say is to understand the cause of things, even at a basic level. Talk to people and understand what is acceptable. When checking with sometimes friends, this is what's going on. They may give some kind of a rational check and balance, common sense approach advice. You can even have a mentor. There are a lot of resources available these days. Just Google it. How you can be a good husband, good wife, or a parent. What is acceptable, not acceptable. There is no shortage of information. It can be confusing also until people are not guided like through a seminar or small group discussion. Strengthening couples and parents, mending broken marriages, training leaders. Through these efforts, even the organization I'm part of, like this Agape Partners, aims to positively impact lives of countless families facing marital conflicts. And we have a network of 7 or 8 counselors. They offer free support as well as resources. And I see 7 out of 10 people have been helped out that is our statistic. Sometimes we have to refer people because it's more clinical. They need more one-on-one help. We have limited resources. Whenever there's a problem, slow down, seek help, and talk to people. If you need to talk to a professional, it's okay to talk to a professional. In this country, help is available, but you have to seek.
That's very true. We do look for help in a lot of different aspects except for like mental health, although it's coming better now. It said you're editor of Strangers in a Foreign Land. Is that a magazine?
It's an edited book which published in 95,
Mm-hmm.
long back, almost 30 years now. That's my own journey to understand with a group of people the struggles of first and second generation. And
First, second generation Indians in America.
Indians, Asian in the United States. I think there's 12 chapters in that book looking at, to contrast what are the different needs, the felt needs of first and second generation, how they are coping up with these challenges. It took almost 2 years, and it was one of the first books from the Asian Indian community to understand from a cultural, spiritual, mental health perspective what is happening in our community, what is working, what is not working, what are the challenges, and what we can do. After that, we had another book came from Dr. Sam George, Coconut Generation. You may be familiar with that. That is outside brown, inside white. That's for the second generation. There's a lot of people are now looking into this. Now we are third, fourth generation. There are a lot of family values, faith-based values which we have. At the same time, there is a lot of good values in the American culture. In the past generation, there's a lot of emphasis on work, money, and family. But yeah, now we have data, whether it helped them or not helped them. Some of the parents now, they have a different mindset, especially those who have been here for 30, 40, 50 years. I consider that's gold mine. You can get a lot of experiences, values. They honestly share. I should not have done this. I've been working, taking 2 jobs, 3 jobs. Now they have tons of money. What are they going to do with the money? Children are all away. They are just themselves there. I think the next generation have to find joy in their life, the true joy.
Yeah.
Rather than being so busy with life. And there is a way to evaluate from a faith as well as from a secular side. That's what I would recommend.
Yeah. I think we'll have to do another talk on the whole disparities of first generation, second generation, third generation. That's actually a pretty interesting talk. But what I like to do in this podcast is make a practical approach to the people that listen on what they can do today to better themselves. And so, from your knowledge and experience and wisdom of doing all this for so many years, have you developed any kind of practice yourself, whether it's in the mornings or during the day or something like that, that you do daily to help you in your mental health or your spiritual health? What does that look like?
I would say when you wake up, you have a lot of fears. When you wake up and you don't have the motivation to do what you're supposed to do, that can be challenging. The way I recommend people is you have a lot of energy also. Look at the positive side of when you wake up, that's the time you have more energy. By the time evening, you're pretty done. The morning time is you have to use it positively. What I would do is personally a time of prayer, meditation, prepare yourself. You may have a lot of fears, but the prayer, faith, meditation, those things will definitely give you hope, more vitality. Then take care of yourself rather of sleeping, lying, and just spending time in the phone. A lot of people these days, they have the phone. They use it it's just hours these days people are on the bed. It's a very unhealthy behavior. It is not good for the brain. That will take away the motivation, and that's not the best time to read all what's happening around the world. That can sometimes no good news is a good news as you read in the morning. A lot of bad news. That's not the best time to read it. Instead of that, you have a time of meditation, prayer, take care of yourself, get a healthy breakfast. Healthy breakfast is a lot of young people these days not taking breakfast.
That conversation was amazing. And if you want to hear more conversations like that, subscribe to the channel. We're going to be posting videos about more of talks with Dr. Idiculla. So if you're interested in the conversations we had, like, subscribe, share. I hope that conversation was beneficial for you. See, in our journey of health and wellness, we want to be intentional, and a couple questions came to my mind that you and me both can think about. First question I thought about is, what are the challenges you face in the community that prevents your growth towards better mental fortitude? I don't know, let's think about that. Number 2, if 1 in 4 people have anxiety, are you the one? Why do you feel anxious? Who can you talk to this week about that? And then the last question is, have you ever tracked your screen time? How can we cut that down a bit? It's funny because you're watching me ask you about screen time, and so hopefully you don't cut me out too much. But let's think about these questions this week, and if you don't have anybody that can help keep you accountable, send me a message. My team will help you stay the course, be intentional, and be accountable, so that together we can both say we're alive and well.